Next up, we have Craig Richardville. Craig is the Chief Information and Digital Officer at SCL Health, a nonprofit healthcare organization made up of 8 hospitals and more than 100 physician clinics, as well as home health, hospice, mental health, and safety net services. Craig has been innovative and transformational in defining and driving the future of healthcare towards a digitally oriented industry, determining a cloud-first, mobile-first, and patient-first approach within SCL Health. Please join me in welcoming Craig to the stage.
Hello. Hey, Craig, what's going on?
Hey, Dan, how are you?
I'm doing well. Thank you so much for joining us today. Pleasure having you on.
Thank you.
All right, Patrica, we're ready for the first slide. Okay, Craig, first question today is, what is your role at SCL Health?
Well, Dan, this is actually in a short period of time, quite the journey. So when I joined SCL Health a little more than 2 years ago, I came in as the Chief Information Officer, which is a pretty common title over the last couple of decades. And in going into the role, one of the things that we're defining as to what our strategy is and how does technology support the strategy. And that quickly led into what digital services is and what it's all about. So after about a year being in the role as CIO, I also became the Chief Digital Officer. So my role today is Chief Information and Digital Officer, which is a combination of both legacy technology as well as the forward thinking on the digital side.
So what's the value of combining the two roles that you now have ownership over?
Being the Chief Information Officer and the Chief Digital Officer really allows the opportunity to have a more unified vision of bringing the technology side of things, the information side of things, the data components into the digital assets and the different engagement pieces of that, getting you more into not only the patient side of how do you maintain and mature that relationship, but also on the consumer side. So those things to me are all coming together. And if you look at in a previous life, I was also the Chief Information Officer, but also was over a period of time became the Chief Analytics Officer, and we merged those roles as well. And I was the CIAO. So when you look at, in many cases, the digital piece, analytics, innovation, investments, there's a lot that overlaps in between them. And depending the structure and depending the culture, some of those are separate roles and some have the ability to come together. And for me right now, this is a great opportunity to bring those together.
Great. Well, thank you so much. So, Patrica, moving on to the second slide without any further ado. Okay, Craig, when it comes to your AI initiatives, what is top of mind right now?
Well, when you look at artificial intelligence and all the promise that we have around that technology, part of it is to really to structure the work. So as opposed to putting everything together, we actually created separate channels of how we're going to do our digital work and our artificial intelligence. And the first one is around the associate or the employee. How are we going to start to create a digital workforce, use the intelligence that the employee has and put that into a technology or a digital format to allow the machine to do a lot of the work. So the first and foremost is focus upon that. When you look at how to do a digital workforce, there's several different ways you can focus on. One is on the call center side. So how do you really start to create that relationship with your patient, in our case, or consumer, and really start to utilize the assets that you built into the machine and allow that to handle a lot of those contacts with your patient or consumer. The second side is actually the patient themselves. How do we start to take some of the intelligence that we have and put that into the self-service mode, really put it into the people's hands? And in today's world, as it has been in the last several years, we all have smartphones, many do. And so putting that intelligence, the tools in the hands of our patients or our consumers will allow him or her to be able to self-service and provide themselves to a potential diagnosis or direction based, again, upon the data that we've achieved over the last several years. And the third one that has prompted is really on the provider side, those that are delivering healthcare in our case. How do we make them more efficient? One way that we're looking at, we're actually going live with conversational artificial intelligence, which is basically taking a patient and a provider's conversation at a clinic, for example, and moving that into a medical note. So how do you take the 15 or 20 minutes that is going on, not only personally, but also medically with the patient, and make a very concise and precise note? So that's the intelligence that we're putting into that space as well as the effectiveness of the clinical care that we're delivering. So things like sepsis crawlers, for example, that goes through our data, helps us identify people that are potentially suspect to septic.
Wow, that's very, very interesting. All those three things that you mentioned. Of those three, which do you personally find the most exciting or rewarding? Just curious.
Well, the one that's the most rewarding is the delivery of the care to the patient. So that is the piece, and that's what we're here for. So when you look at healthcare, the care part of healthcare is really getting people from sometimes their worst moments in life back to a healthier state. And that is the part for me that is the most important. So always keeping the patient first.
Okay, cool. Thank you very much. Patricia, you want to move on to the next slide? Craig, what are the main challenges of AI projects or digital transformation generally? And I know you mentioned those three different pillars, so feel free to take it one at a time or just in general.
Well, I'll actually go in general, because the challenges that I'm going to share really go across the whole spectrum. So first and foremost, it's change management. And you find that in technology over the years, but also now when you look at artificial intelligence and really how we're trying to take some of the data and the assets that we've built over the years and put that into the workflow. So the people factor. So when you look at people, process, and technology for some people, it really is the most complex, but it's actually the easiest to do. And you look at the people piece of it. So many people have been educated or trained or have behaviors that you have to unlearn and really start to manipulate how you want that person to interact now in the future, now that they have intelligence by themselves, that really will help them in their workflow. The other piece I will say is, as organizations have moved, and you see that a lot with certainly younger organizations, is creating a culture of change. That change is something that we live for each and every day. And if you find yourself going for a period of time, a day, a week, a month, without much change, you really need to start to broaden your horizon and look at different aspects that are out there, because there are solutions out there for you to bring into that. So you've got to continue on that change management side. I actually like to reference the 4Fs. So it's fast, fluid, flexible, and focused. So another challenge that we have is really to stay focused. There's so many opportunities out there. You got to be fast, you got to be fluid, you have to be able to be very agile, very flexible in the work, but you really need to be focused, because if you find yourself chasing too many different initiatives out there, you'll find yourself probably not being as successful in any of them. So you got to keep yourself down to people that can be consumable by your team that's putting in place, that can be digestible by your consumer base or your patient base. And also in our case, on the provider side, to make sure that we understand how much change is happening at one time and keep people focused on those that have the biggest outputs or the biggest outcomes that we're looking to achieve.
Wow, very interesting. I mean, through all this rapid change, do you find it difficult to prioritize these various initiatives? I mean, you're naming so many different problems that are going on right now. How do you prioritize?
Well, we go back and look at our strategic plan, our goals that we've established, and those are the things that we really want to move the bar on. So when we prioritize the work and look at these as investments, because there are many opportunities to invest your dollar in and your time management, is to put that into what's going to move the bar the fastest, move it the highest, and start to look at that being the focus of our work. When you do that, you start to really start taking things off. So you start to complete things, and nothing really ever gets to completion, but you move it away from implementation and more into a support stage. And when you start doing that and get that accomplishment taken care of and the returns from that investment, you start to create capacity. And now you can start bringing more things in. So really the things that have the largest impact are the ones that we're going to focus on. And at the same time, we're going to start to improve our capacity by knocking those things out so we can bring the newer things back into play as well. So it's all a juggling act, and you've got a strong board and a strong senior team. It makes it a lot easier for you to stay focused.
I see. Yeah, that makes a lot of sense. When it comes to your AI initiatives, you mentioned, I think earlier in this conversation about the human aspect of it, training and development and stuff like that. Are you hiring a lot of data scientists right now, or you're leaning on vendors most of the time? How are you approaching who does the actual work?
It's a combination. I mean, it depends on the structure of the organization, where you have the investments, what part of the country you live in. We're fortunate to be in a very high-tech part of the country, in the Colorado base area down in Denver. So there's a lot of great talent in our region for sure. But when you start looking at the vendors, I like to call them partners. And it's really easy to separate those that are partners that are really kind of putting themselves at risk with you moving forward with it, as well as those that are vendors that are really more of a commodity base. So we don't spend a lot of time with vendors, but really those that are partners. And those partners, they have certain incentives and achievements for them to realize as well. And they want you to be very successful in a use case and a reference for them in the future. So we try to leverage those relationships as much as we can. So I kind of look at it in some cases like a three-legged stool. So you have ourselves at SCL Health, you have our partner, then you also have the business that's being impacted and or the patient that's being impacted. And those three legs really all need to be unified together in order to have that seat be ready to sit on and to be very stable for you.
Wow, who knew? So you wear three hats. You're a poet as well as the position as well.
A poet didn't even know
really,
it.
yeah. That's great. Patrika, can we move on to the next question? All right, this is very interesting, I think. So what does your vision for SCL Health look like 5 or 10 years down the road? And of course, how is AI involved in this?
Yeah, they're going to line up really close to our channels, as well as to be able to overcome some of the challenges that we talked about. First and foremost, we see it in our personal life and other industries. So when we do shopping, for example, or interact with retail, we kind of do a lot of that self-service. When we do things with financial services, whether it's our paying bills with our checking, our savings, our investments, a large majority of that is self-service. In healthcare, we're going to be following the exact same route. A lot of self-service, but you've got to be able to, again, take the data, turn it into the knowledge and the intelligence, and apply that into very easy to use tools in order for your patients or your consumers to really serve themselves, either on the health side of what we're doing or also on the care side of what we're doing. So healthcare coming together, kind of breaking that out. So how do we keep people healthier and fit? And how do we, those that do have a disease or something that we want to manage, how do we help them, guide them through the care side of it? The more we can utilize people themselves as part of the solution, the better off we'll be. And technology, artificial intelligence, the digital assets that we're building are all components that will make that life a lot easier. On the other side, we've got to also make great decisions. So the decision-making of what we do by really starting to, again, to ingest and consume all the data that we can, make sense of it. And hopefully the data was actually surface things to us that maybe you and I couldn't even think of the question. They'll start giving us some answers. That's where the AI comes into place, artificial intelligence. And with that comes also the people side. One thing I tell people is that, artificial intelligence will not replace people. It will not replace providers. However, the people that don't use artificial intelligence or the providers that do not use artificial intelligence to supplement their work can and will be replaced. So it's a combination of taking the human aspects, which are very specific and can't be solved by the machine, and taking the assets, the intelligence that the machine and the data is feeding it to allow that to happen. And I say lastly, it's really to try to make it part of your rhythm of life, part of your workflow. Whether it's on the first side of being a patient or a consumer, how does that really kind of each and every day come up? So many people, every day they get up, they look at their social media accounts, they certainly eat food, for example, they get and go into work, or they have other activities. And there's a lot of behavior that's there that's really repetitive. We got to be able to take the things that we're building within healthcare and have that be just kind of a normal rhythm of what you do, kind of the rhythm of life. And the same thing on the workflow side. So once you kind of get into a certain scope of responsibility or accountability, how does that become more habitual for you? So really, you unlearn some of the older behaviors and learn the new behaviors. That becomes a repetitive cycle. Each and every month, each and every year, continue to mature in that process.
Wow, what a tremendous vision for healthcare moving forward. I mean, it sounds, incredible. And how long do you expect this transformation to take? I mean, I know we used the 5 years on the slide question there, but how long until this amazing vision comes to fruition would you expect?
Well, if I had the crystal ball, I probably wouldn't be here. I'd be somewhere else. I'm on my yacht somewhere. But however, if you looked at what happened this last year and a half, and with the pandemic and COVID-19, you really saw an acceleration of a lot of this work, and really the ability to be able to start to engage people a lot more often, quicker, more effective. So when you look at 5 to 10 years, nobody can predict that far out. But whatever you can predict, 5 to 10, is probably going to be more like 2 to 3. I think we've shown we can turn things very quickly and get things out there and really start changing the behavior of our patients and consumers, as well as our own internal behaviors of how we serve our customers.
I see. Wow, very exciting. And just one last question, if you don't mind. You mentioned the changing role of people in this transformation. What do you expect the role of the physician, let's say, to look like with this self-service care in play? Any thoughts about that?
Yeah, that's a great question. And I actually have a son, my middle son is a physician. And when we look at and we have the kind of the personal conversations, I'm actually fortunate enough to see him next weekend for the first time since COVID. He practices over at the Cleveland Clinic, so it'll be fun to see him again. But really I want to learn more about what he sees and what those others in the organization see as the role of the physician moving forward. And they are, in many cases, just the brightest people on this planet, and certainly within healthcare, a tremendous amount of responsibility. And as part of our responsibility is to be able to give the tools, as I mentioned earlier, to the patients. So the lower hanging fruit, maybe the easier to diagnose, the easier to treat, aren't things that we need our sharpest people to work on. Those can be a little more repetitive, and we can kind of have that in play. But also, how do we supplement with the immense amount of data that we're achieving that's creating this intelligence, this new intelligence? So as on our side, data and interoperability becomes more and more less of a barrier, and we start to get things more in line, we'll have access to a tremendous amount of information. So how can I, for that provider in their workflow, feed them the right decision-making tools to help him or her be able to achieve the best outcomes, and also in the most efficient way?
And Craig, one other follow-up question. You mentioned you were particularly excited about conversational AI. What is the value or the perceived value of something like this, and what are you doing about it right now?
Yeah, I think there's a whole new world around voice. Many of us have seen it in our personal life in terms of more like voice assistants or voice commands, which is telling things to do things, whether you're talking to Amazon Alexa or whether you're talking to Siri or whatever tool that you're using. But this is truly the interpretation of voice and allowing a conversation to not only to be recorded, but actually to be understood. So when a patient and the provider actually have a clinic visit, for example, and they're together for 5, 10, 15, 20 minutes, how do you summarize that into a very concise note so that not only does the patient understand when he or she has access to the notes, the provider can recall exactly what that conversation was, but also moving forward of the other people within the potential healthcare system that really need to understand, but can't spend 20 minutes listening or understanding what the conversation is all about. So in order to be able to strip out all the outside pieces and focus on the content and bring that into a very, very manageable note really is very exciting, because it allows a lot more efficiency within the healthcare system and to be very effective. So you don't have all the noise that's happening during a conversation gets eliminated and moved out. We're doing something very similar to in our contact centers. So many people have call centers. We're flipping our call centers to contact centers, and we're utilizing voice in front of that in order to manage the conversation and probably in most cases, hopefully resolve the conversation so that it doesn't have to get to a human to intervene. There's an aspect of the human part, and that's really kind of focusing on the digital workforce. How do we take the things that we're doing today and allow the machine to do that work and have a better outcome, a faster outcome, and much more efficient? I like to call it in some cases, in simple terms, like the Amazon of healthcare. So when you look at Amazon, how many times do you really talk to a person at Amazon? Very few, if any at all. Yet you're happy, you're satisfied, 5-star ratings, you're getting your product, quicker, on time, et cetera. And so that's what we want to do here, is really start shifting ourselves from being very driven on the resource side to work at more higher level of contributions, and all the other kind of things that happen each and every day, have the machine take care of that A lot of that can happen with the voice and or through just the digital engagement.
Wow. Thank you so much. Well, I think that's all the questions and time that we have. I mean, thank you so much for being with us today.
Dan, thank you. I enjoyed the conversation and I really appreciate the time.
All right. Patrika, you there?
Yeah. Thank you both so much. This has been such an awesome discussion. And I know the audience is giving you a huge virtual round of applause. So thank you both for sharing this content with us. For the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and check out our amazing AI exhibits. Thanks so much, and we'll see you around.